around that stone. If you absolutely can't, it could be completely blocked, but most likely there is a way around it, so you have to push, and it could be a little painful for the patient.
If he has like BPH, prostate hypertrophy, and it's going to be, the urethra's going to be squeezed,
Yeah, but again, it should go through. You just have to push. That shouldn't be that painful. But kidney stones are sometimes painful because
it stick to the wall?
Yeah, and the urethra is usually raw from passing them, and so it's just painful. Apparently, I've never passed one, but apparently it's worse than childbirth. Passing a kidney stone. Apparently, it's very.
Do we give medication before if we know that they have a
kidney stone? Yeah, if they're passing kidney stones, then they're on some
already, but then it will still be painful if we try to go.
How long does it take to pass kidney stone? It depends.
Yeah.
Some people a couple hours, some people days.
There's nothing you can give a patient like beforehand. You're going to put a Foley. 30 minutes beforehand, you give them something.
For a regular patient, there's no reason to give them anything.
Okay.
If someone is in pain because of kidney stones, then you can, then they already have pain medication ordered, and you can give them a little.
How about anxiety? They're all anxious, like they know it's going to kill. They're freaking out.
Relax.
I would be freaking out, man.
You always get a little bit of urine?
If the bladder is completely empty, you have a kidney problem. Okay, if the bladder is completely empty, you have a kidney problem.
Because even when you empty your bladder, you have a little bit.
Yeah, you should definitely, in someone with functioning kidneys, you're going to hit some urine. But, I mean, you could be in the ER, you could be put in a Foley because they haven't urinated in 2 days, and that's the chief complaint, and the problem is actually the kidneys. So, yes. So if you're put in the Foley and you never, you hit resistance, like what'll happen is the bladder is only this big. Once you get up, and then you'll get to the top of the bladder, and you'll feel a little bit of resistance. Not even a lot of resistance, because you got to know that about 1.5 for a woman, about 4 inches for a man. So if you're in 5 inches, you get a little bit of resistance. You're at the top of the bladder. Go ahead and blow up the balloon and fluid, and let the doctor know there's absolutely no urine in the bladder, because then you're talking about a kidney problem.
It's a serious question, but okay, you're saying 4 inches.